My name is Dr. Luke Arnett. I'm a chiropractor in Dallas, Texas. I'm also an applied kinesiologist. I have 2 diplomate certifications in clinical nutrition. My passion has always been internal organs. If I was a medical doctor, I would probably be called an endocrinologist. So therefore my studies and my interest lies in that, which took me in the pathway of nutrition and trying to help people with their wellness. I have patients that come to me for many, many different reasons. Of course, being a chiropractor, they come to me with aches and pains and creaks and all kinds of injuries, things like that. But I also have patients that come to me with irritable bowel, lack of absorption of nutrients. They come with high blood pressure. They come with high cholesterol. They come with cancer. They come with all kinds of different things that people have. They don't come to me for treatment of those things. They come to me for enhancement of health of the body so the body can naturally fight that. They may be under treatment with a medical doctor or some other type of a doctor, acupuncturist or things like that, but they want to enhance the body's ability to fight its own dysfunction like it was designed to. The amount of nutrition that a person absorbs today is no different than it was in 1960 or before. We typically only absorb 10 to 20% of what we eat, but the amount of nutrients that's in the food is considerably different than it was in 1960 and before. The amount of iron that was in 1 cup of spinach in 1960 is said to take 100 cups of spinach today to equal the same amount of iron. And we used to be told that we are what we eat. That is not actually true. We are what we absorb, what we break down, what we assimilate, what our body can use out of the food, or what the food has in it that the body can use. And with the depletion of nutrients, the speed that the crops are grown today, the lack of minerals, the genetically modified foods, we are not getting nutrition. We are literally starving to death, even though we do not look like a country that is starving. I've been in practice for several years when I realized that even though I sold good products, I handled different types or different manufacturers of products to make sure that I had the exact product that my patient needed, no matter what their problem was. They still weren't getting as well as I wanted them to or quickly as I wanted them to. I realized there was something missing, and so I started searching for that answer. And I ran across a study that was done in the University of Cambridge that showed that taking aloe vera with a meal or with supplements, it enhanced the absorption of nutrients of those meal or supplements 200 to 300%. My product is called Aloextra. The reason it's called Aloextra is 50% of the product is aloe vera. The other half is made up of what most people would call superfruits, antioxidants. But there are several studies done with the different antioxidants that's put in there. One of the studies showed that half a cup of blueberries a day improved memory and cognition. Every ounce of our product has the concentrated juice of half a cup of blueberries. Another study showed that the damage done to arterial walls, causing high blood pressure, decreased blood flow, increasing possibility of heart attacks and strokes, was reduced by 65% with the juice of a half pomegranate a day. Every ounce of my product has that in it. It also has acai, mangosteen, goji, noni, green tea, Concord grape, black cherry, apple, pear, New Zealand black currant, acerola cherry, which is a tart cherry, and it also has a very high increase of high amount of vitamin C in it. We also have a small amount of ginseng to speed up the metabolism, ginkgo to enhance the memory, quercetin, which is a large amount of quercetin, which is a plant-based antihistamine, antioxidant, anti-inflammatory, and the therapeutic component of red wine without the alcohol is resveratrol. The study was done with resveratrol with the amount that's equal to 2 glasses of red wine, and it showed that it literally reversed aging by an independent study that was told on national TV. Though in each ounce of this product has the therapeutic component of resveratrol equal to 3 glasses of red wine without the alcohol. When I first put the aloe vera into my practice, I did a case study, not knowing how beneficial it would be for patients. I was looking for an increased absorption of nutrients. It did that. But by increasing the absorption of nutrients, it also did other things. It allowed the body to increase its immune system. So people with cancer had tremendous change in their blood profile according to their medical doctors. People with high blood pressure, people with diabetes, type 1 and type 2, had less insulin needs. High blood pressure was lowered. Oxygen levels increased. Cholesterol levels went down. People were passing their annual physicals that last year they weren't able to. And I didn't know what was causing it other than a simple increase of nutrients. And I think that is true. I still give my patients vitamins because there's not enough vitamins in the foods that we eat, and we need to increase the nutrients, the absorption of those vitamins. But I think that a lot of people that don't take vitamins and eat well are still going to have a tremendous benefit by increasing the absorption of that. The main thing that I want people to understand about the Aloe Extra product is twofold. It enhances the absorption of nutrients, so no matter what age you are, there's a benefit. There's a secret ingredient in it called the energy formula that actually increases strength. We actually have done independent studies and looking in a process of having a university study done through a machine that shows an increase in strength. But probably the most important thing is the product has a money-back guarantee. At the end of 30 days, if you take this product at a minimum of 1 ounce per meal, if you don't have some improvement somewhere in your life that's noticeable, either, I don't know, better bowel movements, more regularity, less bloating, more energy, better sleep, more strength and endurance. Neuropathy patients got all their feeling coming back in 30 days. Gum disease, according to their periodontist, has gone. Double vision goes away. Blood profiles come back from their medical doctors and showing tremendous improvements. If you don't have some improvement, I don't care if you don't have a problem that you know of, if you're healthy, you eat right, you drink right, you sleep right, you exercise, if you don't show that you have an improvement in energy and endurance, or if you're the 83-year-old lady that has weakness in her ankle and show that she's no longer falling as much, she has more balance, she sleeps better. At the end of 30 days, you get 100% of your money back if you don't have some improvement in your health.